Alison. I am a specialist physiotherapist and I work for the Persistent Physical Symptoms Service. Today we're going to be looking at awareness of normal movement. So our bodies move because we have a skeleton. We have lots of bones in our body, or we've got lots of joints either side of those bones which help us to articulate and move our limbs, move our spine. Now when we have pain, whether that's acute pain, so we've had an injury, or whether it's persistent pain, pain helps us to protect that area, so we tend to not move that area when we're in pain. Now that's okay, say if you've got a sprained wrist or a broken hand, bone in your hand, you're going to protect that area whilst it's healing, aren't you, for a certain amount of time, so as to not to do any more damage. But when we have persistent pain, so when that damage has gone, when the tissues have healed, and we're still getting pain, what can quite often happen is we're still not moving those body parts. So instead of actually moving all of the joints in our body, we tend to just move in blocks. A good example would be lower back pain. So when we get up off of a chair, for example, we tend to use our whole spine. However, if we've got lower back pain, we'll tend to maybe use our hands to help us get up, so we haven't got to use our lower back. And we tend to move in blocks. We tend to be guarding that part of our body, using a bit more weight through our legs, using maybe more of our stomach, using more of our arms, as opposed to using our back. So the idea of this video really is to try to work on a little bit of movement in our upper body, in our spine, trying to nudge into that pain a little bit, to help to try and improve the movement in that area so we're less protective over that area. Okay, we're going to start with our neck. So in a seated position, making sure you feel comfortable and your feet are flat on the ground, feel nice and supported with the back of the chair. And we're just going to start by moving the neck. So we're looking to bring the chin down as far down as you can take it to the chest. So I find that the breathing helps as well, so thinking about regulating your breath. So just starting by taking a couple of deep breaths in and out. Again, sort of down to the diaphragm if you can. And then take a breath in, and then as we exhale, we gently drop that chin down to our chest. Just as far down as you feel comfortable doing. And then just a nice couple of breaths in and out at the bottom. And then breathe in, exhale to come back up again. So I'll show you from the side. So from the side position, breath in, exhale, and tuck your chin in down towards your chest. So we're trying as much as we can as well to keep the shoulders still. We're not encouraging the shoulders to come round at all. We're keeping the shoulders nice and relaxed and down. The movement should just be coming from our neck. Inhale, exhale, and then look back up in front of you. We're now going to rotate from the left and right. So thinking about your neck position, just try to bring your chin just very gently in a little bit, so we're not stooping our head too far forward. We just bring that head back so it's nice and relaxed. So we're relaxing the muscles in the back of our neck, okay? So relaxing those muscles, because as I've mentioned in some of my videos about tension as well, when we're kind of tense and we're overworking some muscles, it's really hard to then get that movement. So we're relaxing our head back. Just almost imagine you've got a piece of string attached to the crown of your head, and it's almost just lifting your head very slightly. Inhale, exhale, and then we're going to look over the left shoulder. Okay, so we're not bringing the left shoulder to our face, we're bringing our face to our left shoulder, just as far as you feel comfortable doing. If you fancy to deepen the stretch, you can place your left hand onto the right side of your jaw and just encourage a little bit more of a stretch, only if you feel you want to. Inhale, exhale, and then come back round to the front. Okay, and then we're going to do the right side. So looking over to the right, inhale, exhale. Again, we're lengthening again through the neck as we come round. And if you want a bit more of a stretch, just placing your hand, right hand onto your jaw on the left side, and then just encourage a little bit more pressure. Now I'm getting my head quite far round. If you've got any neck problems or neck pain, you might not go as far, and that is absolutely fine because we're nudging into what you feel comfortable doing. And the more you relax into it, using your breath as well, okay, getting the oxygen into those muscles and the nutrients into the joints, just practicing regularly, little and often, looking over to the left and looking over to the right and building up gradually, okay? We're now going to look at doing some shoulder shrugs. Our shoulders, the muscles in our shoulders, the tops of our shoulders also feed into our neck. So it's really important that we also get the shoulders moving. So we're going to take a breath in and then exhale. And as we exhale, we're going to bring those shoulders up towards our ears. Take a nice deep breath in and then exhale to drop down. Okay. Inhale, exhale again at the bottom. Just regulate your breathing again. And then a big deep breath in. And then reduce those shoulders back down. So we're not bringing our ears to our shoulders, bringing our shoulders to our ears. We're lifting those shoulders all the way up and then lowering down. Another exercise we can do as well, if we've become quite inactive, or if we've got pain around the neck and shoulder area, quite often it's common to actually have slight rounded shoulders and kind of leaning inwards. So it's quite nice to actually strengthen and work into the opposite direction. So we're stretching through the chest at the front, we're still lengthening through the neck, but we're actually starting to work the muscles in our upper back. So we're bringing the shoulder blades together. So just imagine you've got your shoulder blades are in pockets, so we're trying to get those shoulder blades back and down into pockets into your upper back. So we take the shoulders down and then squeeze them back. As we're squeezing back as well, we're not looking to arch our lower back at all. We're keeping our lower back resting into the chair. It's just an upper back exercise. We're just stretching through the chest, squeezing those shoulder blades together, and then relax. So again, we're heightening up like we were before with our neck exercises. We're lifting the spine up. We've got that piece of string attached to the top of our head that we're lifting the head up towards the ceiling, the crown of the head. And then the shoulders are the neck is lengthened, the shoulders come back and down, and then we're squeezing, opening up through the chest, and again squeezing those shoulder blades together. And you can have a couple of breaths here, in and out. And then just relax back down. Okay, so that's a really nice way to work into loosening off the muscles in our neck and into the tops of our shoulders that are often very, very connected when it comes to pain. Now I'm going to work on a little bit of forward bending. So this is quite a nice way to do. If you have got lower back problems, lower back pain, upper back pain, any spinal discomfort at all, this is quite a nice way to start to nudge into that pain in your back, but unloaded, so you're sitting down, you're not going to fall, you've not got anywhere to go to, it's a safe environment, but you can start to work into your forward movements. So we're going to come into a side position, and I'll show you. So just bring yourself a little bit further in your chair, a bit further forward in your chair, feet flat on the ground. And then from here, we're going to take a breath in, hands on our laps. And then as we breathe out, we're going to do our neck flexion. So we're starting what we did a minute ago with our neck exercises, bringing our chin to our chest, Breath in, and then exhale, we're slowly going down as far as we feel comfortable. So we're just arching through the back. And just slide your hands down your knees as far as you feel comfortable. Inhale, exhale, and then come back up again. And start to feel the pressure through your sitting bones again as you come back up again. And then just lean back very slightly if you want to. So we're just taking our shoulders back, we're arching our lower back a little bit if you want to, if you feel you can tolerate that. Inhale, exhale, and then again drop the chin to the chest. Sliding your hands down again, down your legs. Keeping that chin tucked in, starting to bring your belly button towards your spine. Really curling in as far as you can, all the way down. Inhale, exhale, and then very gently start to slide back up again. Starting to really think about the spine now, all the way up. Okay, so now we're going to do it one more time, and this time we're going to focus on really thinking about the spinal segments as well. So I almost want you to visualise your spine as like building blocks, and just think of the building block at the top, and we're just bending over that building block, or even maybe think of yourself as like a piece of wallpaper that we're peeling off of the wall from the top of the wall all the way down to the bottom. So we start from the top and working our way down. So starting at the top, breath in, exhale, and think about rolling the shoulders in. So we're starting to stretch through the upper back, and separating the shoulder blades. Start to roll forward, and then we're starting to think about the middle of our back now. And then lastly, we're starting to think about our lower back. And then if you can get any lower, you'll notice your tailbone will start to lift as well as you come further down. And then as you come up again, you can slide your hands up, but if you feel you need to begin with, just use your hands. It's a little bit of support up your legs, and start to think about bringing that spine back up to neutral again. So we're bringing the tailbone back underneath us, coming back onto our sitting bones, and then the lower back, and then the middle back, and then the upper back follows, and then the head. So we're back into our neutral position. Okay, so that's a really nice way of starting to get into some movement through the spine if you're struggling with back pain. Another exercise we can do as well to help to mobilise through the spine is some rotations. So you can either have your hands resting on your lap, or if you prefer, you can have your hands resting across your chest. Taking a breath in, exhale. As we exhale, we're going to bring our hands over and round to the outside of our right thigh. So both hands are on the outside of the thigh. Put a little bit of pressure through the thighs to encourage yourself to come round and just get a nice rotation through on that side. Breath in, exhale. Breath in, exhale, come round. And then a couple of deep breaths in and out again at the end, stretching through the other way. And then come back to centre again. So you can also cross your arms across your chest and come round. That's obviously encouraging more movement through the spine without your legs helping, the pressure from your legs. But that's another little progression for you if you want to move into your stretches here. And then if you want to start to use your arms on the equation as well, bringing your arms out in front of you so they're 90 degrees parallel with your shoulder. Breath in, exhale, and then just start to open up that right side. Inhale, exhale, bring the arm back. Inhale, exhale, rotate round. Inhale, exhale, bring the arm back. And as we're doing this exercise, we're still thinking that we're nice and long through the neck, and we're just bringing those shoulders down, Okay, so we're working on the upper back as well. We're strengthening through the upper back. We're opening up through the chest, allowing the oxygen into our lungs much more readily. And we're working on rotation through the spine. Okay, so that's a nice way to kind of build yourself up into that movement. And then relax down. Okay, I hope you enjoyed that session and I look forward to seeing you soon. Thank you.